there are a lot of social issues here as well that you probably would not see elsewhere. We have people that cross the border, we have people without insurance, we have people that have never seen a physician in 50, 60 something years. So a lot of other social issues, but we do our best, we do what we can. With the help of you guys, we're hoping for a much brighter future than what we have today.
Rice bioengineering students are here in the Rio Grande Valley, immersing themselves in the community.
We are going to talk about how food insecurity is impacting the Rio Grande Valley. We're going to talk about what does healthy eating really mean.
When they go back to Rice, they're going to bring with them the local needs they discovered.
What we'll see here at Clinica is you'll see a representation of really the community that we have here in the valley, in this immediate region.
And work to develop healthcare innovations to support thriving urban communities.
We're the lead in terms of diabetes in the state of Texas, top in the country. We're the top for obesity in the state of Texas, and we're one of the top in the country as well. And we're also, unfortunately, we're one of the tops in terms of highest amputation rates. We need you, wonderful brains like yourselves, to come alongside, I think, the physicians and see how you all can maybe help with some of the struggles that we see.
You guys have to get closer.
This has been seriously a life-changing experience for me. Getting to view the patient perspective and gain that insight just kind of sheds a whole new light on these diseases and these conditions and the challenges that revolve around these conditions that we may or may not see every day.
And then did you have any recurring ulcers before amputation?
Actually, they cut my toes off first and I didn't have no wound care.
We have some pretty strong partners who are able to deliver strong experiences to let them see many different stakeholders and to see a health challenge that maybe a medical device is what's needed, maybe it's also like a social program. There's so many complex factors, and so I think it's a really good exercise in thinking about complex problems and what is the role of the engineer and how do all these things interrelate.
What happens here on the ground is there's a really beautiful community of people who are very dedicated to quality of life of everyone who lives here. There are issues of access to care, but there are also many socioeconomic determinants of health that can be addressed at the local level with what we have and the resources that we have.
And so that's what we try to do here at Brownsville Wellness Coalition, is just turn a tragedy into something better, grow food, and just make this community a lot better.
This is the reason why I'm doing the research, why I'm doing, to serve communities that need it the most. And having all that knowledge kind of helps contextualize some of the research I'm doing and kind of keeping that goal in mind when I want to, for example, develop a new type of technology or a sort of drug delivery system.
There's a difference between making something that works and making something that can actually serve others, and I want to make sure I can make something that's impactful.
This partnership that UT Health Houston has with Rice has been really fun and engaging, and it's always great to be able to kind of show off the valley and see how it's a jewel of South Texas, because people get so wrapped up in the rhetoric of what they hear about the valley, and then you experience it and you're like, wow, this place is incredible.